you are really good at what you do, you will be, sitting in meetings with chief ministers, prime minister, cabinet secretaries, things like that, because they'll take your word seriously. If you're very good at research itself, you can also become the principal scientific advisor to the prime minister.
Job of a family medicine physician look like, and how is it different from community medicine? We will be deep diving into CV and freelancing in later segment again. So, in this segment, what are the job of a family medicine physician look like, and how is it different from community medicine?
I would say it's more patient focused, family medicine. You work in an OPD, clinical setting, chronic disease management, diabetes, hypertension, dyslipidemias, IHDs, and other common communicable diseases, cough, cold, and things like that. Nowadays, adult vaccination is a very big thing. Health screening. Many insurance companies they offer under their cover health screening for corporate employees. So health screening is basically you should have very good idea about investigations, what are the common risk factors, and you have to probably explain to them. So it's good. It's in a way it's preventive only, right? Preventive health screening only. So it's fun. Clinically also you're there, and preventive health screening also you're doing. Adult vaccination is a big thing now. There's no proper guideline, by the way, I mean, for adult vaccination. Pediatrics, you guys all know. So those guidelines are going to be developed soon. You could also partner in that, and so there's less aspect of public health of doing health programs and things like that, but you can still do a lot of community work with family medicine. So if you are looking for that higher weightage in clinical care, family medicine is there. It's like an equivalent of family medicine in the UK, or a primary care physician, that you would say. Thing is, in India you can directly go to a neurologist or a neurosurgeon. So the system of wanting to go to a primary care physician is something that is being developed. But if you're very good at what you do, you can carve out a name for yourself. It takes time, but definitely doable.
So, sir, what are the key non-clinical careers, both government and private, available after community medicine, and how does the progression typically look like in this career?
Yeah. Non-clinical, again, government and private, I would say, I've already explained, like some ministry posts are there, NHSRC, Ministry of Health and Family Welfare, many government organizations. Then private, again, there are many consultancies also now, like, I don't know if you've heard of BCG, Bain, all those agencies. They look at they'll have some health projects. So if you're very good at management, and you're very good at program management and operations, things like that, they'll be looking for you, man, because as a doctor, you're giving so much more insights. So career progression, I would say, it depends on your networking. Honestly, I'll give you one common meeting with a potential partner or funder, right? It'll open up new avenues. So make sure you work well, be nice to people, talk to them, irrespective of whichever field you're in. I'll give you an example. I was at ICMR, and then one of the people who saw the way I worked, they were very happy. They said, "Will you come in on board for this project here in Bangalore?" So I didn't actively go and seek out that role. Because the kind of work we do, they were happy, and then they kind of lead you to the next thing. So that's how things are. As much as you ignore it, even in any field for that matter, you have to be nice, you have to network. So progression that way is how it depends on how well you talk to people, and how diligently or honestly you work. So I would say one thing leads to another. Anyway, we'll discuss common ones, from what position to what position you can go. But this is my uh, common advice.
Well, sir, is there any chance to become the cabinet secretary of health ministry after community medicine?
Yeah, so you cannot. Cabinet secretary is a IAS post, right? But there are many public health people. For example, I'll give you the director of NHSRC, National Health System and Resource Center. He is Atul Kotwal, sir, Dr. Atul Kotwal. He is community medicine, and even this one, NHA, National Health Authority, the one who rolled out Ayushman Bharat. So that is Dr. Shankar Pinjaswar from PGI Chandigarh. So he was the acting director there. So and there have been many doctors and public health professionals who have gone on to have very high post in the ministry as well. And I am not very sure, but I believe one famous doctor who was a physician to Gandhiji, she became the health minister. So health minister also is a very definite possibility. And if you're working at other places like NITI Aayog, there are many senior consultants I have seen who are from the community medicine background, having a diverse work experience. So you can if you are really good at what you do, you will be sitting in meetings with chief ministers, prime minister, cabinet secretaries, things like that, because they'll take your word seriously if you understood what I'm saying. And if you're very good at research itself, you can also become the principal scientific advisor to the prime minister, right? So that's also something very interesting. Like Dr. APJ Abdul Kalam was the first PSA, if you know. So he had worked in DRDO and things like that. So if you're working very well at your research level, that's what it is, science, right? So if you have public health is research is very diverse that way. If you're purely medicine, that is one thing, but public health, there are so many things involved, and you do something very interesting. I think.
Yes. So, sir, I was also I also saw something about UPSC and Ministry of Health.
Mm.
That there I was I got to know about teaching versus non-teaching careers. So, can you elaborate on this for our audience?
Sure. So central medical CMSC and CHS sub cadres are there. So usually there is something general duty medical officer sub cadre is there. There is a teaching sub cadre for like assistant professors. They'll be filled through interviews. Okay. And there is a non-teaching cadres where there will be UPSC interviews. There's a public health sub cadre also where again interviews are done. The recruitment is basically there is a written exam, then there is an interview for both teaching and non-teaching positions, and the interviews will assess whether they can go into either of those. Then the ministry will submit a requisition saying to the UPSC saying these are the posts that need to be filled. Then there will be a contractual appointment to address these doctor shortages. So that's usually how things go. So it's basically standardized central government recruitment kind of process. So I think if you go to the UPSC CMSC website, you will be able to figure out how to go about it. So teaching and non-teaching again depends on the vacancy and depending on how much of your experience counts. If you worked as an SR or you've done some research experience, teaching makes sense. Non-teaching would be more so if you worked for something else on programs or you worked in the field, anything like that. I don't know the exact selection criteria, unfortunately. It depends on person to person. But yes, this is the usual procedure, is what I understand.
So, sir, you have worked with NITI Aayog, and for those who are unfamiliar with it, what is NITI Aayog and what was your role in the organization?
So NITI Aayog is basically National Institute for Transforming India. So that was the new name given to the Planning Commission. Okay, this is from 2015. So I worked as an intern in the health division at NITI Aayog during my MD only. So I also forgot to mention. So as part of our syllabus in MD, right, we're also given an opportunity for 2 months to go to any national institution of our choice and do an internship there. So a few of my colleagues, they went to ICMR, National Institute of Nutrition. They did internship there. I applied to NITI Aayog. I did an internship there. So you can also go to the program officer of an entire state for TB or malaria or whatever it is. So it's part of your experience that you get from. What I did there at NITI was I worked on the policy document for national program on organ transplant. So I don't know if you know, recently there's a hospital here in Bangalore that transported an organ for transplantation in the metro. Okay, you used to imagine, green corridor and all that. So there are SOPs that need to be done. So we worked on that. I also worked on health insurance for people who can't afford Ayushman Bharat. I mean, who are not eligible for Ayushman Bharat and they can't afford private insurance. And I also worked on policy documents for a chief secretary's conference. So that chief secretary's conference was chaired by the prime minister itself. So these kind of documents you kind of go through very detailedly, see if there are any issues, go do a lot of research. You have to back each sentence with a reference. You cannot just give a blank statement. So I learned a lot about how to be meticulous, how to be very comprehensive in whatever information you give. So that's usually the things that I worked on.
Moving, so sir, you mentioned about internship. So how do you how do the student apply for this internship? Is it through connection or there is a routine thing that goes in the college? How do you figure out that this thing is for me and how to apply for that specifically?
Okay, so either of these internships, you have to apply anyways. They have an online portal for be it NITI Aayog, be it ICMR, NIE, or anything else. Connections, I wouldn't say it's always necessary, but if you do know somebody, if you put in a word, it's always helpful. That is what I would say. But either ways, it's all merit based. They don't discriminate or put somebody who's not at all accomplished to give here. So everything has a portal now. That's how you kind of do. Trust me, if you put out cold emails, I have sent cold emails. Cold emails meaning you don't know the person, they don't know you. You just put it out there saying, I'm so and so, I'm really interested. These are my accomplishments. This is what I want to work in. Can you help me? I really want to get in. People are not as bad as you think they are. Sometimes, even during as a company owner, some people had reached out to me saying, "Is there a position open? I want to be an analyst," and they've put out their own CV. I never even asked for it, and they were so open to all the ideas. I want to do this. I want to do that. Can we schedule a call? I'm very interested. I scheduled a call. I really like what they did, and I hired them. So it really is a matter of being proactive. You shouldn't self reject. Never self reject. You should always kind of push through. Say milega, nahi milega, nothing like that. So one of the ICMR post, the eligibility was maximum age limit was 70 years. Where am I? I'm just like early 20s and 70. You will think it's a very senior people only apply. I just applied and I got it. I'm not boasting. This is how it works. You don't in your mind only self reject. Always try. Always try. So you never know. I've had so many of my colleagues who have gotten into NITI Aayog based on their own accomplishment. None of those connections or anything. That's what I would say. But I mean, if anyone is interested in reaching out, maybe they can have a word with me. I can kind of guide them what they need to put into their application. That would be something I can try and do.
You will mention your LinkedIn profile if you are comfortable, so they can connect with you.
Yeah. Definitely, you can share my LinkedIn profile. I'll be happy to guide anyone who's interested. Yeah.
So, and when is this internship? Like, is there any specific duration of the
Yes.
course to go, or is it any time we can go?
So these internships usually you have to apply 6 months prior to when you want it. That is also a thing. You cannot just apply a month before. So for my, I went in October. I applied for October in June. I got it in November eventually. So that's how early you need to do it. And usually it's those 6 months. The second half of the year is when you usually have these internships open. So you need to apply 6 months at least in advance, have everything ready, and then you will get a call just 10 to 15 days before the actual date. So you don't need to be concerned. It's been a month, 2 months, it will take time, unfortunately. Yeah.
And do we need any prior experience in this domain, or we can go as a fresher?
No, that's what you can still, because you're an intern, right? As long as you are displaying some sort of skill, I think main thing would be how well your CV is polished and how simple it is for people to read and understand. Sometimes people write a lot of unnecessary things, where they're from, and if they're married or not, and all that. I don't think too many of those details. You just need to be to the point. So it depends on person to person. Maybe if I will look at the CV, I'll say, okay, this is good, this is not suggested. So based on that, I would say don't really worry about the experience for the internship part. If it's like a big position, maybe yes, you would need it. Either way, you would still apply. But yeah, internships is supposed to be during your studies, right? You wouldn't be expected to know a lot of things, so it's okay.
Okay, sir. So you have also worked as a consultant epidemiologist at National Institute of Epidemiology. So
Hmm.
what are those involved, and what is the scope of epidemiology for all those who are looking for career in this field?